My name is Juan Pablo Segura, and I'm one of the co-founders of a company called 1EQ. And our main product is called Babysteps, which is a mobile prescription for better pregnancy. Our focus is to use mobile and digital technology to improve the way doctors and patients communicate during the 9 months of prenatal care. We're a bridge that introduces a lot of these innovative technologies in ways that both patients can consume and also doctors can leverage and use in their day-to-day lives. George Washington University Hospital is our pilot partner and our first customer, and they have always been interested in using digital technology to its fullest extent. And so when we started working with them about 3-4 months ago, they were very interested in how we were bringing in digital technologies. We actually bring in wireless scales and blood pressure cuffs into the standard of care. So patients, right, are checking their blood pressure, they're weighing themselves every day. That information is actually going straight to the doctor. And our technology looks at different patterns and trends and actually assesses for risk. And so, for example, if your blood pressure is off for 3-4 days, all of a sudden we can alert the doctor, and then the doctor can work with the patient to actually improve the pregnant mother's health. Most patients have smartphones, and they're not really being used to their fullest extent to improve healthcare. And so that's really what we're focusing on with our product, Babysteps, and with the ecosystem of different products that are available to both patients and doctors. There's something called preeclampsia, and preeclampsia is something that can sometimes be found if there's abnormal weight trends, right? So we really want to focus on conditions like those. We want to make sure that pregnant mothers have their doctors and have a lot of these resources available to them to have a better pregnancy experience. And so it's really, where we want to go with our product is really introduce technology in a way that works with a pregnant woman's life flow and also a doctor's workflow. Helping mothers have as much information as possible at their fingertips through their phones, while also having the peace of mind, right, that their doctor can pick up trends and can understand things that are happening in the data, right, and in the cloud and through the scale and the blood pressure cuff. And that's really how we see ourselves, changing the way prenatal care is delivered in this country and hopefully everywhere else.